So a couple of pieces of positive news in an extremely, extremely dark time. Health insurers have said that they are going to protect their customers from out-of-pocket costs if they need treatment for COVID-19, because obviously during an epidemic, you want to make sure that people aren't infecting each other by staying home. Instead, if they're really sick, you want them going to the hospital. By the way, if you are really sick, do go to a hospital, okay? Especially if you're in a metro area. If you are seriously ill, go to a hospital. I know there are a lot of people saying, don't go to the hospital because maybe they're overrun or maybe you'll be worse treated at a hospital. If you're really ill, you need to go to the hospital. Do not stay home. And you'll know when you need to go to the hospital, is what I've been told by doctors, that it gets so severe, you're having trouble breathing, go to the hospital. Don't wait until it has already been difficult to perfuse your lungs with oxygen. Get there while you are still sentient and breathing would be the rule. Two of the nation's largest health insurers, Cigna and Humana, agreed to protect their customers from out-of-pocket costs if they need treatment, a decision that represents a rapid change in how companies are responding to the pandemic, according to the New York Times. Describing the insurer's decision as a big deal, President Trump on Sunday said companies don't waive copays too easily. We asked them. They did it. While insurers and government officials have taken steps in recent weeks to limit people's out-of-pocket costs when they get tested, the bills associated with treatment for COVID can run in the tens of thousands of dollars for a single hospital stay. David M. Cordani, the chief executive of Cigna, said, let's take the economic burden and the economic uncertainty off the table. Under the new policy, customers don't have to worry about the financial burden of the virus while their lives are being turned upside down, said Bruce Broussard, the chief executive of Humana. Remember when industry was super duper duper terrible and evil and horrible and terrible and evil? Turns out private industry is really stepping into the breach in a lot of these situations. Last week, another large insurer, Aetna, which is now part of CVS Health, said it would waive cost sharing related to hospital stays. Employers that self-insure provide coverage to the majority of workers in this country. They would not be affected by the insurer's decision. They would have to decide individually whether they would take similar action. It's going to be a client-by-client decision, said Cordani. So that at least is a piece of good news. The insurers are trying to relieve the burden from that. Another piece of good news, the FDA has issued emergency authorization of hydroxychloroquine. And the media are upset about this for some reason, some members of the media. I mean, listen to the sub-headline over at Politico. FDA issues emergency authorization of anti-malaria drug for coronavirus care. The drugs have been championed by President Donald Trump for treatment despite scant evidence. Okay, the emergency use authorization means people are on their deathbed, like they are going to die. And the FDA is saying, these people who are going to die, you know what would be better than death? Trying this thing that has not yet been tried in clinical trials, but has shown some promise. And Politico's first response is, why would the FDA waive these rules? What are you, an idiot? They're waiving the rules because people are on their deathbeds and they want the treatment that they think may have shown some promise. Here is President Trump yesterday in the Rose Garden announcing that hydroxychloroquine is being used in New York City.
I want to point out that the hydroxychloroquine is being administered to 1,100 people in New York, along with the Z-Pak, which is azithromycin. And it's very early yet. It started 2 days ago. But we will see what happens.
The agency is allowing for the drugs to be donated to the Strategic National Stockpile to be distributed and prescribed by doctors to hospitalized teen and adult patients with COVID-19 when a clinical trial is not available or feasible. See, I don't know why the media would be upset about this, considering a clinical trial is not available or feasible. We're in the middle of a pandemic, you morons. Like, seriously, one of the big problems with the FDA, I mean, there's been a push by Republicans for years for right-to-try legislation that basically suggests if you are a terminal patient, then you should be able to try anything that you want to try. You shouldn't be held back by the FDA approving clinical trials of particular material. And believe it or not, people in hospitals, doctors, are not going to start prescribing fish tank cleaner, or as they have been in Iran, I'm not kidding, they were using toxic methanol. Seriously, people were telling them, take toxic methanol, and people were like giving it to their kids, and their kids were getting blinded by it because things in Iran turned out to be quite horrible. Like, this virus is bad enough without stupidity causing people to die. So if everybody could quit with the fish tank cleaner, the eating of the bats, and the taking of the toxic methanol, that would be extremely helpful at this point. But if a doctor prescribes hydroxychloroquine based on the fact that it's shown some promise and you're on your deathbed, like, what are you whining about that the FDA removed the regulation here? The move was supported by the White House, part of a larger Trump-backed effort to speed the use of anti-malaria drugs as a potential therapy for a virus that has no proven treatment or cure. FDA already has allowed New York State to test administering the medication to seriously ill patients. Some hospitals have added it to their treatment protocols. Trump himself said at a press briefing, let's see how it works. It may, and it may not. HHS Secretary Alex Azar tweeted on Sunday night, scientists in America around the world have identified multiple potential therapeutics for COVID-19, including chloroquine and hydroxychloroquine. Career scientists have been skeptical of the effort, noting the lack of data. Okay, like, seriously? This is where you're going to draw the line, guys? I feel like this is probably not the place you want to draw the line. Meanwhile, Dr. Anthony Fauci is saying we are ramping up capacity. Another piece of good news. People are going to get what they need. And also, there's this push by the media that suggests that President Trump has to have a good personal relationship with governors in order to help supply them from the federal level. And Fauci's like, calm yourselves down. That's not what's happening here. People who hate Trump are still getting what they need, which, by the way, is true. Right? I mean, I'm going to show you two different Democratic governors in a second who are thanking the feds for their response on this. Here's Fauci saying this is not a personal thing. This is just business, Sonny.
One way or the other, he needs the ventilators that he needs. And hopefully we will get him the ventilators that he needs. They may be closer to him than is realized, but if they're not, we'll get them there. And if they are, we'll try to help him get access to the ones that are there. I mean, I know the spirit of the task force, and when we talk about when people need things, it doesn't matter who they are. We try to get them what they need.
Okay, and that, of course, is absolutely true. Like, for example, Louisiana Governor John Bel Edwards, he says the stimulus that you guys have all been criticizing, that you and the media have been ripping is insufficient, the stimulus is definitely going to help people in my state. Here's Louisiana Governor John Bel Edwards.
The $2 trillion package that Congress passed, that the president signed into law, we know is going to help with hospitals, with unreimbursed expenses, the expansion of telehealth. We know that families are going to benefit, small businesses, employees.
Is it enough?
Nutrition for our schools and our food banks. Well, you know, it's a very generous package. It's the largest one in the history of our country.
Right, but is it enough for you?
There's about $1.8 billion for, well, there's $1.8 billion for the state that's going to help. And so there's going to be additional legislation coming forward, I believe, as well. But we know that this is a good start, and I appreciate everything that they have done in Congress in order to help us.
By the way, listen to the questions there, right? I mean, it's terrible. I mean, the members of the media who are spending all of their time just asking people, is it enough? Is it enough? I mean, they're looking for bad news at this point. How about this? How about when a Democratic governor of a state says that the feds are doing their best in providing help? You say, oh, that's good news. Instead of, is it enough? What more can you get out of them? Like, I don't think those kinds of questions would be forthcoming if this were a Republican governor during Hurricane Sandy talking about how Barack Obama had provided all the support necessary. In fact, I know that wouldn't have happened because it didn't happen in 2012 when Hurricane Sandy happened and Chris Christie was hugging Barack Obama on the tarmac. And the media were treating Barack Obama as the savior of the East Coast during Hurricane Sandy for doing like basically what the federal government should just do as a baseline in the middle of a national disaster. Right? And the media's been treating it like this the whole time. Right? CBS's Margaret Brennan, she had Steve Mnuchin on, the Treasury Secretary. And he was saying, like, we're providing stimulus. We're doing our best here. Margaret Brennan was the same person who was questioning Governor Bel Edwards there, if you didn't hear her. And Margaret Brennan, she's saying to Mnuchin, you don't know all these jobs are going to come back. You don't know all. Of course he doesn't know all the jobs are going to come back. Nobody knows all the jobs are going to come back. This is the greatest shutdown in the history of the world economy. Without a doubt. Without a doubt. I mean, we have literally forcibly shut every business in the United States effectively. And Margaret Brennan's like, you don't know all the jobs. No bleep, he doesn't know all the jobs are going to come back. Nobody knows all the jobs are going to come back. That's one of the hard parts about dealing with, an unprecedented global pandemic, Margaret. Here she is on CBS.
Do you need to level with the American people here and tell them you simply don't know that all these jobs are going to come back?
This program is going to be enormously successful in stabilizing the U.S. economy, while hardworking Americans who lost their jobs or aren't able to work because of the medical situation, that they get help. So this money is going to go into the economy very quickly. It is going to help American workers very, very quickly. And I don't know how long it's going to take to kill this virus. I do know we will kill this virus. And when we do, I have great confidence that the U.S. economy will become roaring back.
Okay, but I mean, it's the questions that are like, everyone knows this. Does everyone ever actually think that the jobs are magically coming back after the greatest shutdown in the history of the world? Literally? I mean, Jay Inslee from Washington, who hates Trump, right? Hates Trump. And Trump is no fan of Jay Inslee. Inslee yesterday, he said, we're grateful to the federal government for doing what they're supposed to be doing here and providing us support.
Now, we're getting help from the national stockpile. We have got thousands and tens of thousands of masks and gloves, and we really appreciate from the federal stockpile. We're having soldiers. The 627th from Colorado arrived yesterday to build a hospital for us in CenturyLink Field. So there's some good things happening from the federal government, and we have a lot of gratitude for everybody involved in that.
Okay, so again, while the media are out there suggesting that the Trump administration is doing a horrible job, most of the governors who are speaking up about this, including Andrew Cuomo, by the way, are saying the feds are giving us what they can. Maybe they started late, but everybody screwed this thing up. And that's going to be one of the themes we're going to talk about in a second here, is it is very easy to see the bias of the media. Some good journalists, like Jake Tapper's been extremely critical of Trump, but you'll see he actually went after Bill de Blasio yesterday. Some in the media are spending their time pretending that the federal government, led by Trump, was uniquely wrong on this coronavirus thing. Let's be real about this. Everyone was wrong about this coronavirus thing up until about 3 weeks ago. Up until it became obvious that this was going to become a serious issue in the United States, people across the aisle were not taking this seriously enough. And the media are now doing this revisionist history where it was only one side of the aisle because Trump is the man in power. It was only one side of the aisle that was not taking this seriously enough, and that just is not true. It just isn't true. Facts don't care about your feelings, and it's a fact that The Ben Shapiro Show is the largest conservative podcast in the nation. Be sure to hit the subscribe button to stay up to date on all of our content.